Our next task we'll be looking at is depression due to work stress. Depression due to work stress. In this particular case, you're an FY2 in a GP surgery. Okay. Now seeing Jane Haynes, who was presenting some concerns. Okay. Now, generally, she has been feeling pressure at work. She will tell you, doctor, just the pressure at work is too much. Okay. Doctor, I cannot cope with work. So that's the cause of the whole problem. Okay. So she works as an accountant. Okay. She feels that in the last 6 months, they've been giving her too much work and she's struggling to cope. She cannot meet the deadlines. She had made a few mistakes at work, but her manager has not complained or has not blamed her. It's just herself. She feels she should not have made those mistakes and she feels that she's struggling to cope with the work. Her mood is 4 out of 10. She cannot sleep until about 2 a.m. We need to be able to ask, is there any particular reason why you cannot sleep? Is there something that you keep on thinking? Okay. Until 2 a.m. and then she has to wake up very, very early and sometimes around 5 a.m. in the morning. So there's not much sleeping that is happening. The husband has also mentioned that her behavior has changed recently. Okay. The boss is very supportive and has not blamed her. Okay. She's so busy with her work that she doesn't even have time to cook. Okay. So she buys takeaway all the time. She used to go for exercises, but now she no longer does that and she's not even interested to do that. She feels that her energy levels are low and they've been struggling to actually cope with the work. So what's going to be our approach? Our approach is as usual. This is a depression approach. We have looked already on the approach to depression, how we approach them generally. Yeah, introduction, grips as usual. What's the opening sentence? Doctor cannot cope with work. That is our opening sentence. So we're going to be starting, okay, so what job do you do? And how long have you been doing this job? Can you tell me what you mean by you cannot cope with the work? Okay. Is it too much work? Okay. And when did you start feeling that the pressure at work was too much? When did you start feeling? And how long have you been working in this job? It's very important. Before 6 months ago, were you coping well? And have you spoken to anyone, at work, maybe your manager or your boss, that you're finding the work to be too much? Okay. And does this all work thing cause you anxiety? If yes, causes me anxiety, do you experience any anxiety symptoms like palpitations, shortness of breath, or maybe feeling on the edge all the time? If the answer is yes, feels anxiety, it's important for us to ask, how do you cope with all this stress? How do you cope with the stress? How do you cope with this anxiety? This particular patient drinks a lot of alcohol to cope with the stress, has started smoking more to cope with the stress, and finds it difficult to sleep. Some of this alcohol intake and smoking also may contribute to poor sleep as well. Okay, so he's trying to cope by drinking alcohol. Now, this is somebody who cannot cope with the stress. Does the patient has got a depression? So to look at the differential diagnosis, is it simply stress or there is a depression? Now, in here, it is important for us to look at the core symptoms of depression. Okay. So learn to ask about the core symptoms of depression. So the first question is, in the last month or so, have you been feeling depressed, feeling hopeless, or down at all? The second question is, do you have little interest or pleasure in doing things? This is anhedonia. They are the two core symptoms of depression for us to say whether this is a depression or it's not a depression. Okay, good. Now, if at least one of the two above symptoms is present, then that may suggest it's a depression. So ask it the following questions. Sleeping problem, insomnia. What time you go to bed? What time do you fall asleep? Do you wake up? What time do you wake up? Any weight loss, any weight gain. Depression can come with weight loss or weight gain. Any fatigue or loss of energy. How are your energy levels? This particular patient has got low energy levels. Do you ever feel agitation? He has got agitated. Agitation or slow movement. Yeah. Slowing of movement. This is or slowing of movement. Yeah. Let's change that. Or slowing of movement. This patient feels he does things slow, is not coping with work, and feels agitated because he's got anxiety. Yeah. So this one, so just going to change it up there as well. So 2 of this one. Okay. Other symptoms to ask. So let's go. Just to change that one. The other symptoms of depression. Okay, these are the other symptoms of depression. So 2 of the above we discussed before, the 2 core symptoms. If one of them is positive, these are just the other symptoms of depression. Okay, so let me write that: the poor concentration, feeling of worthless, feeling of guilty, suicidal thoughts. Okay, we're going to be asking all the symptoms of depression. Now, the effects of symptoms is important. Has this affected the relationship with your partner? My husband feels that I have changed. So somehow it has affected a little bit. Okay. Are you able to do your daily activities like cooking, looking after your home, looking after yourself? Do you have any children? Are you able to look after the children? So you have to find the overall effect of symptoms. She's struggling with work. Husband feels that, behavior has changed. Okay. And then we're going to be asking how she's coping with everything else. Not good because she's trying to drink more alcohol to cope with the situation. Okay. Now, what are going to be the other differential diagnosis? Anxiety in here. Okay. It's just anxiety over what? It's unlikely here. It's just a simple anxiety is coming because of something, stress at work, and it's only one of the symptoms. Post-traumatic stress disorder. Did anything happen before you started experiencing all of these things? Domestic violence. Check relationship. How are things at home with your husband? Has he ever been abusive towards you or aggressive towards you? We need to be asking about that. Hypothyroidism, important differential diagnosis. Okay, complete the rest of the history. That's the PMAF dosa, the ICE, and of course, summarize. We already discussed about the effects of the symptoms. Examination, you need a thyroid examination and a systemic examination to check that everything is okay. Then explain the diagnosis. It's likely to be having a moderate depression. It's affecting the work, not able to cope with work, feeling the stress at work, blaming herself for some of the work. Okay, energy levels are low. There is insomnia. Okay. Has lost of interest in daily activities because she used to do exercises, she's no longer interested. So we may say that the most likely here may have a depression, and most likely a moderate depression because of the way it has affected you. So what you're going to do, like we discussed, we looked at through an approach to depression. The treatment is counseling, a CBT, because we feel it's a moderate depression. Medication like antidepressant, advise to talk to her manager at work. Okay, ask, do you have occupational health department at your work? If yes, she can go there. Okay, talk to friends, talk to family. Okay, pursue the hobbies. We're going to, as usual, like all other depression, follow up in 2 weeks' time because she's 30 years and above. And if somebody is less than 30 years, it's follow up in 1 week time because it's affecting, relationship. So we have to send them for couple therapy because the husband has noticed that she has changed as well. Offer the leaflet about the depression, safety netting with a crisis card. Okay, and we have discussed already how to explain the crisis card in the general approach of depression. Okay, we have to do some routine blood testing. Okay, to make sure it's not anemic. Check the U&Es. Yeah, that's the U&Es. So let me just write that again. U&Es. Yes, liver function, glucose, thyroid function, CRP. You have to check for all these ones. Okay, good. So that's easy. This particular case. Thank you.